Good evening. This is the BioLab Nightly News reporting to you live from Ball State. My name is Ality Tamble, and with me I have my co-host, Sarah Howard.
Today we will be informing the general public about the popular illness of influenza. In this broadcast, we will be discussing things like symptoms, who it affects, and ways of prevention. We begin tonight with what exactly this illness is.
Influenza, the flu, is caused by viruses that infect the nose, throat, and lungs. The virus we usually face is referred to as seasonal flu. Both the cold and flu have similar symptoms such as congestion, sore throat, sneezing, coughing, headache, and chest discomfort. However, with the flu, you are likely to run a high fever for several days and have body aches, fatigue, and weakness. Symptoms of the flu also tend to come on abruptly. Usually, complications from colds are relatively minor, but a severe case of flu can lead to a life-threatening illness such as pneumonia. So, Sarah, how can someone get this flu?
That's a great question, Allie. The flu virus is spread from person to person through respiratory secretions and typically sweeps through large groups of people who spend time in close contact, such as daycare facilities, classrooms, college dormitories, offices, and nursing homes. The flu is spread when you inhale droplets in the air that contain the flu virus, make direct contact with respiratory secretions through sharing drinks or utensils, or handle items contaminated by an infected person. The flu virus on your skin can infect you when you touch or rub your eyes, nose, or mouth. That's why frequent and thorough hand washing is key to limiting the spread of influenza. The flu symptoms start to develop from 1 to 4 days after infection with the virus. Now, let's hear Allie talk about who is at the greatest risk for the flu complications. Back to you, Al.
Thanks, Sarah. While anyone can get the flu, infants, the elderly, pregnant women, and people with chronic illnesses such as diabetes, heart disease, lung disease, and HIV are at the highest risk for flu complications. Specific strains of flu can be prevented by a flu vaccine, either a flu shot or nasal spray flu vaccine. In addition, antiviral medications are available to prevent flu. These drugs may help reduce the severity and the duration of flu and are best used within the first 48 hours of the appearance of flu symptoms.
What are more ways one can prevent the flu, Allie?
Well, you can prevent the spread of the flu by doing a few simple things. First, like I stated before, you can get vaccinated. This is the best prevention for the flu. However, you can also wash your hands often and use the proper technique. You can also cover your mouth when coughing or sneezing. The best way to do so is to use a tissue, or if one isn't available, to cough or sneeze into your elbow. Lastly, you can use disinfectants around your home that are effective against viruses. The flu virus doesn't live long outside the body. It usually stays on surfaces for no longer than 24 hours, unlike other viruses that can live on surfaces for days or weeks. If you do get the flu, there are a couple things that you can do. Sarah will now tell them to you.
Healthcare providers such as your doctor treat the flu with supportive therapy, which includes recommending the following: drinking more fluids, getting plenty of rest, using nasal spray to relieve congestion, soothing your throat with crushed ice, sore throat spray, or lozenges. Case of the sniffles, what should I do? It's really simple to safeguard the flu. Head to the clinic for a shot vaccination. Control the spread, educate the nation. Vaccinate first offense on the front line worldwide. Influenza won't survive. Provide access to tissue, water, and soap. Cover your mouth when you cough and nose when you blow. Wash your hands as often as you can. Hand sanitizer and follow this plan. Clean your area, especially the surface. Use antibacterial leading brands ensure this. Learn about the flu, there's no need to fear. Prevention goes a very long way, so go get your flu shot and have a nice day. Thanks for tuning in to the BioLab Nightly News. Catch us next week where we cover a contagious skin infection found in the showers of La Follette. Back to you, Miss Callemeyer.